Okay, everyone, good afternoon and welcome to Breathmatters.
Much more complicated.
And for the people here physically and the people remotely. So it looks like remotely we've got Eileen and Dot Ivy. So I'm not sure if you guys know, but little Miss Dot had a little bit of a tumble. Is that the right way to put it, Dot?
That's one way to put it.
And so she cannot physically be here with us, but she is remote with us.
Jen, I can't hear you.
What I'm going to do is after our presenter, I am going to go through some business stuff. So to respect the time of our speaker, I'm going to have Bob introduce our speaker.
Hi, my name's Bob Lindholm, and I guess part of the reason he's here is tied in with my story with pulmonary fibrosis. About 7 years ago, I was diagnosed with pulmonary fibrosis. It didn't seem to be the classic IPF fibrosis, so I call it the little IPF. We didn't know what was causing it, but it was still pulmonary fibrosis. And we monitored it with time. Gradually kept getting worse. And my pulmonologist would ask me, have some reflux? I said, no, don't think so. Next time I saw him, I said, are you sure you don't have acid reflux? Said, I don't know. Says, well, I'm going to set you up with a dysphasia specialist. And it turns out that, yes, I do have swallowing difficulties.
No.
Some of it goes back to when I had a disc removed in my neck, where they did surgery through the front.
How do I get back?
That was 40 years ago. Apparently, acid reflux can get worse with age. Your muscles don't work as well as it did when you're in your 20s. Apparently, pulmonary fibrosis itself can aggravate acid reflux, and acid reflux, aspiration of acid reflux can aggravate pulmonary fibrosis. So apparently, there's some almost interplay. I ended up working with Lauren, and it's Lauren Rosales. She's a dysphasia specialist. And she is tied in with Pulmonary Associates of Richmond. So, you know, all my appointments and everything tied in through Dr. Sarno and then with her. And I just felt like that regardless of what your history is of pulmonary fibrosis or any lung disease really, that being aware of the potential impact of aspiration of acid reflux is something you need to be aware of. And so we got her on the docket here today. And the floor is yours.
Thank you. You explained everything super well. So, like I said, my name is Lauren, and I'm a swallow specialist with Pulmonary Associates of Richmond. And I kind of fell into this area because I was working in long-term care and, you know, really wanted to specialize. And with Pulmonary Associates, you know, patients come to me. I don't have to go knock on their door and like, hey, it's time for therapy. But, you know, especially when it comes to breathing and swallowing and all of those systems are so closely related that we're really finding that if we improve your swallow function, your breathing actually gets better. Your energy level gets better. Your lungs are healthier. And so seeing, you know, the consistent progress with a lot of our patients that are making these changes and improvements, it's such a rewarding area. So, but what I want to do first is play a quick video for you, and it's going to talk about some of the different things involved in swallowing. And then I'm going to jump in and focus on the respiratory system and swallowing. Is this going to play sound? Okay.
It will. It might be pretty soft.
Sorry, guys. I can't figure out how to get back to this screen.
Swallowing is a complex process, using nerves and muscles to move food from the mouth to the stomach. After chewing, the prepared food is collected by the tongue, making it ready for swallowing. During this stage, the larynx closes tightly, and breathing stops to prevent food and liquid from entering the lungs. Food or liquid then enters the esophagus, which carries it to the stomach. Dysphagia occurs when there is a problem with any part of the swallowing process.
Can't hear it, Jimmy.
Accurate diagnosis is vital to successful dysphagia management. On the left is a video of the modified barium swallow, a one-dimensional X-ray view of the patient's swallowing mechanism. You can see the black, barium-coated bolus as it passes from the mouth and pharynx on the way to the stomach. On the right is a view of the Dysphagia Systems Test, or DST. The full-color view shows the food or liquid as it passes into the pharynx and is aspirated into the trachea, viewed in the center of the picture.
That was in 2010. That was a population that number was.
The first is the respiratory system of dysphagia, and is best defined as the ability to hold your breath for 1 to 2 seconds while the food passes over the airway and into the esophagus. In this view, as the food falls from the back of the tongue to the pharynx, your vocal cords should close, and your epiglottis, shown in orange, should flip down over the true and false closed vocal cords to provide a 3-prong level of protection. If any of those 3 things don't happen, the food or liquid will fall through the vocal cords, into the trachea, and then into the lungs. This is called aspiration, and is how aspiration pneumonia begins. The second system of dysphagia is muscular. This is defined as the ability to chew and move food through the mouth, down into the pharynx, and into the esophagus. This view illustrates that there are many coordinated movements that need to work in harmony to swallow safely. If the patient's muscles are weak, the muscles may work out of order or with little strength. The result is that the airway is not protected as it should be, and food or liquid may enter the airway, sometimes unchewed. This is very toxic to the lungs, and is also a choking hazard if stuck in the trachea, thus blocking the ability to breathe. The third system of dysphagia is the gastrointestinal system. When food is swallowed, it transits down to the stomach in a unidirectional movement, meaning only heading downward. When in the stomach, the food mixes with stomach acid. Reflux occurs when the food moves bidirectionally, back up into the esophagus and pharynx, and into the airway. When this reflux drips into the airway and is aspirated, it's like pouring acid into your lungs, and is extremely toxic. The fourth and fifth systems of dysphagia are cognitive and neurological. With the cognitive system, the swallow is triggered in the central command of the brain. This information system tells the brain that the food entered the mouth. It's sweet, sour, needs chewing, needs a strong or weak swallow, or needs to suck on a straw. And finally, how much strength the pharynx needs to squeeze it into the esophageal opening. It even determines how big the esophageal opening needs to open in relation to the bite size taken. It also alerts the airway that reflux is happening and that the acid needs to be prevented from entering the airway. It's an amazing system. The neurological system then allows for these signals to be sent to the brain. If those nerves are malfunctioning, there may be little to no recognition, and the system doesn't know that the airway needs to close, or that the food is precariously close to the airway following the swallow, or that reflux is falling into the airway. A person has no response because they don't know it's happening. This is how silent aspiration occurs. A breakdown in any of these systems puts the patient at risk for dysphagia. Dysphasia management systems. Accurate diagnosis.
Okay. So all that to say that there are a lot of different things involved in swallowing, that it's not just, well, my muscles are a little weaker. Well, every time you swallow, you hold your breath. You have COPD or pulmonary fibrosis, or you just got done for a long walk. That's a marathon for your lungs, because what needs to happen is there's a lot of coordinated movements that your airway closes off, the epiglottis flips over and protects your airway while you swallow. And your whole voice box moves forward a little bit. And in order for everything to move over your airway into your esophagus, which is where the food goes. And then after you finish swallowing, it takes a second for everything to re-coordinate back into place. And so that's a lot of micro movements
Well, they should be able to
that
hear
need to
them.
be happening at the right amount of time. You know, the strength, coordination, timing, all of those things can be really impaired if we're not able to hold our breath for those couple seconds. Or what if we take a really big bite and I got to hold my breath a little longer because it's kind of stuck in there. So we're going to jump a little bit. Maybe. How do I get back to your Gmail? Okay. Nope. Sorry, I just want to share my screen with the Zoom crowd. Maybe. Sorry, operator error for there. Okay. See if that. Okay. All right. So what we're looking at first, this is what it looks like behind your Adam's apple. So if we took a camera, went straight in your nose and looked straight down, this is what we're looking at. So right in the middle, that opening goes to your airway, down to your lungs. This V shape here, the sides of the V are the vocal cords. They anchor into this cartilage up here that we want to be pretty small and kind of bony and prominent looking. Looks like 2 lollipops hanging out in there. So tucked in here, that's where the opening to the esophagus is, and that's the tube that goes down to the stomach. This at the bottom, that's your epiglottis, and that's that flexible cartilage that should flip down and protect your airway when you swallow. Now, here is where we run into some other things. If you've had some of those anterior cervical cervical spinal fusions, you've had any of those anterior incision surgeries, sometimes this changes how it works. Sometimes the muscles don't move that flap appropriately. Sometimes there's so much swelling and irritation in there that it's harder to swallow. And so then we need to modify that swallow a little bit. Maybe there's some different positioning techniques, or sometimes softer food that is just work smarter, not harder. We don't need to crunch it all down. Sometimes things that are a little smoother go down easier. So this is this is what your throat looks like. I think that it's zoomed in a lot. I don't know how to fix that. But okay, so this is looking at another throat. So right here, this one's much more red and swollen and irritated. So right here, that's where those arytenoids are, that cartilage. Right here, those are the vocal cords. And they're a little bit more irritated than that last picture we looked at. So whenever we swallow, our vocal cords come together. We've got 3 levels keeping our airway safe. Our vocal cords come together. This tissue on the side squeezes together, and then that flap flips down. So there's a lot of, again, those micro movements all need to happen at the right time, the right speed. Sometimes we might take a sip too quickly, before that flap is over. And we've all had that where, oh my gosh, okay, it's in the wrong spot. I really got to cough that out. And it's very uncomfortable. So this right here, that's the epiglottis, and that's going to flip down and cover this whole space here when we swallow. But now let's look at this throat. Zoom is in really far, so I think that the clarity isn't as good as it should be. But right here, right tucked in here, that's the esophageal inlet, and that's where that food is supposed to go. But whenever we get any reflux, this is where it comes back up. And here we can see this red acid track where it's stripped over and left a little burn mark going down toward our lungs. So this kind of reflux isn't always associated with heartburn, indigestion, those typical things that we know and love with reflux, right? We know not to eat spicy food, or we know what's going to happen and how we get heartburn. With this kind of reflux, when it comes up into our throat and drips over toward our airway, it's called respiratory reflux. It's also called silent reflux because we don't know we have it most of the time. You know, that it might present like, well, I clear my throat a lot. Well, I might have COPD and I just make more secretions. So is it just my lungs, or is it allergies? Is it what I ate yesterday? Is it that I didn't get enough sleep last night? We don't always attribute that stuff in our throat as, hey, there's a problem that I need to rectify. But what happens is when it's getting up into this sensitive tissue and it can get towards your vocal cords, then our voice gets a little bit hoarse. And sometimes they don't fully come together to protect our airway. So that's one level of protection for your airway that might not work as well. And if one level is slightly decreased, that puts you at higher risk for something to get into your lungs. So here's another one. Sorry that these are kind of grainy, but we can kind of see where this acid tract has dripped over. And you can see these darker rings also in the trachea, that it has gotten into the airway, and it does cause that irritation and more shortness of breath, more fatigue. And it makes, you know, if we have COPD, we're more likely to have reflux, but that reflux makes our COPD worse. So it's going to have a really negative reaction on any of our lung things that we already have going on. And so, you know, acid reflux, what is it? So we all know that it's that backflow of acid back into our throat. And so a lot of times, you know, we experience heartburn or indigestion, things like that, when it's that lower down reflux. But, you know, like we were saying, it's that silent reflux that we're really finding, really over in the last, you know, 10 or 15 years, are we really finding that this is a problem? A lot of us will go to the lung doctor. Hey, I'm coughing. Hey, your PFTs actually aren't that bad. You know, you don't respond to the bronchodilators or the inhalers or things like that. Well, maybe it's not originating from your lungs. Maybe it's actually this acid reflux coming back and causing these respiratory problems, just because where it comes out is right next to your airway. And so a lot of times, you know, it might not be during the day. We don't feel that burning sensation in our throat, but it's a lot of times when we go to bed at night. And that's when that stuff gets in there significantly more than during the day when we're up and moving around. Now, if we also have things like COPD or other different pulmonary things going on that create more secretions, that's also going to change the sensation of your throat. You know, if you put Vaseline on your hand and then run your hand under water, you can't really feel that water. So if you have a lot of thick secretions in your throat, you're not feeling that stuff come back up. Or maybe if we swallowed weak and we've got stuff, you know, kind of left over in there, we have the decreased ability to feel that. And so it puts us at higher risk for pulmonary compromise. You know, most people, we don't know that we have it. Let me see if I can change this. Sorry, I just want to make sure that it's exercise. because it's cutting off some of the words on the screen. So I'm trying to figure out how to zoom out slightly. Alright. Well, I won't mess with it, but
I don't know what would happen if we had a smooth one of these.
But the big thing with this silent reflux is that most of us don't know we have it. We go to the pulmonologist because we are coughing or we have symptoms that present with pulmonary complications, and maybe we do have COPD or asthma or chronic bronchitis. And so the silent airway reflux really heightens those problems and makes them worse. And it's the #1 cause for enigmatic cough. So that just means we don't know why. If the lung doctor says, we've tried everything, I don't really know what else we need to do, you know, because you're still coughing despite doing these different medications or treatments and things like that. And sometimes it's not originating from your lungs. It's actually this respiratory reflux. And so a lot of times, why don't we have, you know, the normal indigestion symptoms with this kind of reflux? And so one of the theories is that the tissue at the bottom of your esophagus, it's built to withstand some of the acid that it's experiencing because it's right next to the stomach. So if we get a little bit backed up, it's not as damaged as quickly. But all this area, this tissue in your throat, in your larynx, and all your airways, that is very sensitive tissue. It doesn't take very much reflux in order for there to be a problem. And so here's a lot of different names for it. We've heard about GERD, you know, heartburn, Barrett's esophagus, esophageal reflux, things like that. But it all kind of falls under the same umbrella. But when it impacts our lungs and our breathing, then it's that respiratory reflux. And one of the things too is that it's really become much more prevalent that we talked about. You know, it's older people. This is an achievement we get as we get older, and maybe our body processes foods a little bit differently. But this has actually increased really dramatically over the last several decades. That it's on a really high increase because look at our foods, you know, that a lot of our canned foods and a lot of our canned and jarred and things in bottles, there's extra acid added to that. FDA regulation says it has to match the pH of your stomach. So that's actually really acidic if we're sipping on a soda. It's got the bubbles in there. It's got the caffeine. Caffeine increases acid production in our stomach. And so sometimes we're accidentally doing things that, you know, when I was in my 20s and 30s, I could have coffee on an empty stomach, or I could eat that food a little bit later, or I could have a snack before bed. But as we get a little older and our lungs become a little bit more irritated, those aren't things that we can do as much anymore, or at all, that we have more dramatic effects. So this is just, you know, a lot of numbers and statistics that it's just increased like 500% between 1990 and 2000. A lot of that has to do with our dietary changes, that rather than eating at home a lot of the time, you know, we do a lot of things on the go or packaged things that are already pre-prepared. And a lot of those have more preservatives, more fats and things like that. And that triggers more of that reflux. So again, you know, it's become a younger person's problem more frequently because of our diet and our lifestyle and things like that. But those are things that we can control, which is great. You know, if we can control these things and our reflux gets better, then maybe our pulmonary fibrosis gets a little bit better, or that lung scan, hey, you don't have those ground glass opacities anymore because you're not microaspirating your reflux. So these are just the prevalence that it's really spanning the ages now, rather than people, you know, in their 60s and 70s. Look, these numbers are almost the same. People in their 60s or 70s, about 40% of people have reflux, but so do about 40% of people in their 20s, that we're just not aware of what we're doing and what we're eating and how that can impact us.
Good question.
Yeah.
Is weight a factor? So that we as a population.
Right, absolutely. That, you know, weight can be a factor. If we're a little bit heavier, that's also putting more pressure on our stomach and its contents. And so it's a little bit harder to breathe and hold our breath. But also it's applying that pressure. It makes it easier for things to come back up into our stomach.
Well, why is esophageal cancer
The fastest growing.
because of all this reflux that's happening so consistently with people that, you know, with our,
We've had reflux all along.
but really in the last like 50 years, you know, the way that we processed our food and fast food and drive-throughs and things like that, like a lot of people don't cook at home nearly as much as we did, or if we do, maybe it's a frozen meal, or maybe some of it's canned, you know, from a jar rather than all home cooked. And so it's just increasing that the acidity of what we're eating and drinking, and even just, you know, soft drinks are wildly acidic. And so that creates a huge problem in your esophagus. And that Barrett's esophagus leads to, that's the precursor of esophageal cancer. And so there's a couple ways that we can do what I do. I do swallow testing. And so I have a little camera, take a little peek in your nose, and then where that hangy thing is in the back of your throat, that's where I stop and look down. So then we can see, well, what's it look like in there? What do your pictures look like compared to a normal throat? Do you have those acid tracts? Is there swelling and irritation? Because when that swelling is in there, then it's harder to swallow, it's more sensitive and irritated, but also sometimes that impacts our breathing. You know, it can get a little bit obstructed, and it's harder to get the air in or out.
I'd say something. You said that this is on pharyngeal cancer. Better for worse, I had an aunt who smoked heavily and drank. She got laryngeal cancer. So if you smoked in the past, or if you drink every day, and I'm not saying a lot, but even just one drink a day, and you're a little overweight because of all the prednisone and things you're on, and you're eating canned pasta sauce or jarred pasta sauce and drinking Coke. That's why this is being increased. It's the past catching up because it's cumulative, but also what we've been doing to ourselves, eating a lot of processed and ultra processed foods.
Or tending, you know, I tend to be a night owl. And so then, you know, at 10 o'clock at night, you know, a snack sounds amazing. I'm not hungry. It just sounds good right now. You know, it's kind of a comfort thing. Well, if we do that and then go to bed and our stomach is actively digesting, you're pretty much guaranteed to have some of that acid in your throat. And if it's in your throat, it's right next to your airway that some of that can drip in. And, you know, the next day, maybe we're clearing our throat a little bit more. Maybe we're a little bit more hoarse. Maybe it's hard to just take that full breath and really get the air in there comfortably. And so whenever we reflux, it brings up an itty bitty molecule from our stomach called pepsin. And so that molecule can float all over. So sometimes, you know, if we wake up and we slept on one side and we're kind of stopped up, not necessarily my nose is running like crazy, but it's just the air is not moving over here. Well, you probably refluxed, and some of that molecule triggered that swelling and irritation, and it's harder to breathe. And so for some people, they wake up with a little bit of ear pain. And so it can trigger, whenever we get that pepsin in our throat and it causes those acid tracts, our body creates more secretions to try to neutralize that acid. Well, again, you know, if we have any pulmonary things that we already have more secretions, we might not notice that, hey, I'm clearing my throat a little bit more. It might just be the progression of the beast. But, you know, there might be some things that we can do about it so that it can be more comfortable and easy to breathe, and it doesn't impact your lungs so negatively. So again, you know, these are some of those symptoms. Chronic cough is the number one. You know, I hear all the time from my patients, well, I just cough and I don't know why, but my chest scan is fine, or, you know, my breathing test came back okay. And well, okay, well, what triggers it? Well, I don't know. Sometimes I'm just sitting there, and sometimes it's when I'm eating, sometimes it's after. Sometimes it can be if we lay down at night and we're horizontal, we don't have gravity to keep everything down where it's supposed to. That's when, if we have nighttime coughing, if we wake up in the night coughing, that can be some of that reflux that we're experiencing. But it also presents like with hoarseness, sometimes choking episodes, or I just feel like there's something kind of stuck in my throat. Like there's not, I can swallow, but there's a lump here. That's a symptom of that reflux. It doesn't mean that something's stuck in your throat. It just feels like that because of that irritation that's there. And so again, you know, with that reflux, it triggers more shortness of breath. And so ultimately, breath matters. And so we're going to talk about some breathing techniques too. But, you know, if there's anything that we can do to minimize the negative impact on our lungs. You know, if we have that option, absolutely. You know, and this is something that I emphasize with these patients, but also in my own home, that, you know, I do love a good soda sometimes. Don't get me wrong, I'm not perfect, but you know, we can't have those once every single day or a couple times a day, maybe just once or twice a week. Maybe let's have it for lunch instead of dinner. That way, some of that acid has calmed down. It doesn't mean we can only eat these 8 bland foods and that's it, because that's not the case. That most of us with reflux can bring those things back in. We just need to use moderation or be careful about what time or how much. So if I have a big piece of pizza and a soda and I follow that with a milkshake, I'm kind of creating the perfect storm. But if we can space some of those things out or maybe not eat too much at one time, that can decrease that risk of reflux. So again, there's just a long list of symptoms that's getting into your throat and causing more of that obstruction. And you're more likely for that airway to close off and cut off your breathing. But COPD, airway obstruction, you know, postnasal drip, a lot of these things all have a very close relationship. And so, you know, if we have COPD, we probably have reflux. And then reflux makes that COPD worse.
Oh, Paul walking and the deer ain't paying him no mind.
Okay. So what can we do about it? So the big thing, or one of the big things, is changing our diet. Sometimes just changing our diet, like what we eat, how much, what time, that might be all that we need to change. It might mean, you know, maybe not having coffee on an empty stomach first thing in the morning. Maybe it means not eating too late at night. Just making some of those changes, that's all we need to do. Now, some people, you know, they do need stronger medications, and that's something that talk to your doctor. Is that appropriate? What other medications are we on? Sometimes if people are on thyroid medication, they have to get the timing just right because they can't take thyroid and reflux medications in the same morning. It would have to be like morning and night, and sometimes that timing can be really tricky. But typically, if you can avoid that reflux for 2 weeks, so I know doing the detox diet is no fun for people. I hear it a lot. But if we can avoid those things as much as possible, give your tissues a break from that acid, it'll start to rejuvenate. And then it's less irritated. You're less likely to have that cough. You're less likely to have that stuff come up into your lungs. But then we can slowly bring some of our favorite foods back, you know, keeping track of, well, am I coughing more since I added that piece of chocolate back? Or, you know, can I have that once in a while? Really paying attention to when do the symptoms happen? You know, how bad are they? Did I eat or drink something within the last day or two that sometimes can impact that? Because with reflux, and this is one of the challenging things with that, is that it can affect your body immediately as soon as you eat it, or tomorrow, or the next couple days. That sometimes it's not just, well, I ate something last night and I feel it today. Well, maybe what I ate Saturday morning is still affecting me today. You know, as it processes through our system, there are certain foods that relax the muscles at the bottom of your esophagus and the top of your stomach. Well, then whatever's in your stomach is going to leak out easier, especially if we do something like that right before we go lay down. Now our stomach is full and we lay down and that gate's not staying tight to keep everything down.
Catch a picture of them.
Did you get one?
No.
All right, so a lot of times there's really 3 ways that we deal with reflux. You know, medications, and there are some over the counter, but it would still be a good idea to talk to your doctor. Is this something that I can safely introduce? Now, a lot of medications, though, it's important that you take it 30 minutes to an hour before you eat or drink. And so sometimes it doesn't always say on the label, it just says, you know, take before a meal. Was that 5 minutes or is that an hour? You know, if we take it 30 minutes to an hour, what it does is it goes in and calms down the stomach and prepares a nice spot for your food. So if you're taking it with your food or even right after, it doesn't have that same prep time and it's not going to be quite as beneficial. There are surgical options, but I tend to be on the more conservative side. Let's see if there's diet, lifestyle, different changes that we can do first, because we can always undo, you know, well, I took coffee out, but I can put it right back. Versus surgery, you know, it's really hard to undo a surgery once it's done. But the big things, and this is what I focus on a lot, are your diet, your lifestyle, things that are, for the most part, within our control. So-
Do you mind telling them, what is vagal function?
So that is the nerve that innervates your voice box. Yeah, that's your vagus nerve. And so sometimes if we've had a lot of upper respiratory infections, it can damage that nerve. And so then we're stimulated to cough, maybe by cold, smells. It's not just food or drinks. Sometimes, like if we've had COVID or if we had pneumonia several times, and so this nerve that innervates in our throat, it can be irritated and trigger you to cough by other things. And so this is where it gets a little bit tricky too. Those vagal medications, those are things like amitriptyline in small doses or gabapentin, things like that, where it's a nerve medication to try to calm down that stimulus. And typically for things like that, it's not, you're on this medication forever. It's, let's get your body used to not coughing and then wean you off of that medication as the nerve kind of regenerates and fixes itself. And you were talking about, those changes. So in the last 50 years, a lot of us were eating at home and those packaged foods. And, as we've industrialized the world, we've kind of spread that all over the place. And so it just impact only Americans. It doesn't matter your age, your race, your gender. It just kind of hits everybody across the board. So really about 125 million people have reflux and only about half of us know. Because, for the most part, it is silent. It doesn't present like our traditional heartburn and indigestion. And so it does make it harder to diagnose. But talking to your pulmonologist or speech language pathologist, things like that, then we can identify, is this one of the root causes of my cough? Are there things that I can do? Are there changes that maybe I need to make with my diet or when I eat? And that can really help improve all of those symptoms. And those saturated fats, more high fructose corn syrup, that's a big one that is in a lot of foods too. But also, we have more organic pollutants in our food too, that treatments with different chemicals, really trying to help the plant grow, that if any of that ends up in our system, it can trigger more of those reflux episodes too. And then that increased dietary acid, again, that's going back to in the 1970s when there was a food poisoning outbreak. After that, the FDA regulated that, things in jars, things in cans, things in bottles have to have a certain acidity so that as it sits there on the shelf, it doesn't grow bacteria and fungus so that it's healthy when you get it home. But then that's a lot more preservatives. So trying to think about, when we're really trying to be extra healthy and eat our very best, shopping the perimeter of the store, because that has the least amount of preservatives. That's the fresh, the frozen. And if we do frozen foods, maybe vegetables that don't already have a cream sauce already added to it, because there's more preservatives in that flavoring versus just the frozen vegetables. That's just going back to why they added this acidity. But if you flip a lot of, like your soda, if you flip it over, one of the first two ingredients is going to be citric acid or ascorbic acid, or on juice, it'll say vitamin C added. And it sounds really great, but that citric acid is acidic. And now that, apple juice is a little acidic because of the additives that, are in there. It's not that apple juice itself should be acidic. It shouldn't. That should have a better pH that we can tolerate. But other things like orange juice, lemonade, that's the really citric stuff that's more acidic. And so when we talk about a differential diagnosis, if we have shortness of breath, I always ask my patients, is it harder to breathe in or breathe out? Because difficulty getting the air in is reflux, because your body with that obstruction narrows a little bit. It's trying to protect your airway. So it's harder to get that air in. It's trying not to get any of the acid in there. But difficulty getting it out, that's asthma. And so if you're having that shortness of breath and going, well, my asthma treatment's not working, I don't have a problem getting air out. Well, it's not really asthma, or not the way that we're thinking of it. We're not treating it correctly. But an inhaler can be helpful for a lot of people with asthma or with reflux too. And so, what can we do? with those changes. All of these things take time. It's kind of figuring out what works for you, what's something that we can feasibly incorporate in our lifestyle. Because if it means we can't do Italian night 3 days a week, well, is that going to totally disrupt my family dynamics that I have going on? Or are there ways that I can kind of modify it slightly so I can still do family dinners, but just decrease some of that acidity, or maybe some of the onions, or cook it in a slightly different way so that I'm not sacrificing social time. But also, like, it takes time and trials, and what works for one person doesn't necessarily work for someone else. You know, there are a lot of foods that are very acidic, but they don't necessarily impact everybody the same way. Like 85% of people will reflux after drinking a soda, but only like 50% of people might reflux from eating garlic. And so, you know, it's a little bit of trial and error to see, well, what are the things that maybe I have to avoid completely because I know that causes me a problem. Like if I have soda and chocolate, it's such an uncomfortable scenario for me, very specifically. But, you know, I can have chocolate by itself, or I can have a little bit of soda sometimes, but it's creating that perfect storm together. Thanks to trial and error, I know to avoid that so that I'm not triggering those symptoms. But also, it's okay to celebrate what feeling better feels like. You know, when, oh, I didn't wake up coughing so much, or I took my walk and I was less short of breath. You know, those are little successes that it's not always, all right, next week you're going to feel so much better. Sometimes it's a slow progression that, well, I'm just clearing my throat a little bit less, or I have less drainage. Even though the pollen is crazy, I'm still breathing okay. Well, perfect. That's something that we are absolutely headed in the right direction. So when it comes to diet, there's a lot of different aspects of this. Well, you can't see them. Sorry. There's texture, there's consistency, acidity, timing, the combination of foods and drinks. And then how do we manage special occasions, like going to a birthday party when maybe my nephew's favorite food is really spicy chili, and then we're going to have chocolate milkshakes afterward. Okay, how can I navigate that without triggering, you know, a coughing episode? But, you know, the big thing is taking control of that power, that ability to breathe. Because if we know what things can decrease our breathing and impact that in a negative way, if part of difficulty breathing and part of the frustration with that is that loss of control. It's like, I can't feel like I can get my breath, and now I'm stressed, and now I'm anxious. But if we can give you some of that control back, it's huge. You know, that, you know, if I have to sleep in a slightly different position in order to breathe better tomorrow, great. There's little things that we can do. So when it comes to timing, you know, that relationship of, well, am I having pizza for lunch and then Mexican for dinner? Or, you know, are we doing a bunch of things on our plate all at the same time that triggers that? You know, same with food and drinking. Just like, are we having a glass of wine after dinner, after we ate something a little bit more acidic? So the timing of, you know, eating to changing position, you know, do we eat and lay down fairly quickly? Even positioning while we eat and drink is important, because are we eating a little bit reclined in the recliner, or are we sitting on the couch and we're nice and collapsed? It feels good, but okay, well, that's not very much air I can get in. If I have to hold my breath every time I swallow, maybe I should scoot to the edge and
Did you see the
I
deer?
can double the amount of space that I in my lungs just by changing my posture. And so thinking about ways that we can improve our swallowing and our breathing and decrease that risk of reflux, it all works very, very closely together.
I give you some of the meat you eat.
So again, you know, texture is important. How much do you have to chew something? Do you have a really dry mouth? You just need to add a little bit of gravy to that. And sometimes, you know, patients that have, or people that have fibromyalgia, you know, we might wake up and have this much energy. By the end of the day, your energy cup is very low. So maybe dinner isn't the big meal. Maybe it's a matter of something that's nice and soft, soup or pasta, because I ran errands today and I went to the doctor's office and
We tried to get
all I can do to sit up through dinner.
You can take it
Well,
on
then
your
let's
phone.
make it something that's easy. It's not going to be a big chunk of chicken breast that we really, really gotta chew it down really, really well. And then, all those little micro movements to swallow, if we're worn out from the chewing part, we have less energy for the swallowing part. So sometimes it's just making things that are a little bit softer to eat. So maybe graham crackers instead of, like tortilla chips or like anything that you bite into and kind of explodes. That's going to take a little bit more work versus like a Ritz cracker. If I bite into that, it leaves a little teeth mark, that breaks up pretty easily. And then some foods are just easier to digest because if some foods sit in our stomach for longer, they can create more problems. So like fried foods or foods that are higher in fat take longer to digest and they're inflammatory. So those kinds of things can cause problems all through the rest of the next day as it's processing out of your stomach. But other things like brown rice is easier to digest versus white rice. Cooked vegetables, they're going to be easier versus raw vegetables. Not just to digest, but also, as a snack. I could absolutely chew a raw carrot and swallow it, but it's going to take me a little while to get it down soft enough. I'm going to swallow and swallow again, and then I'm probably going to take a sip and swallow because there's still little bits that are kind of hung around in there. Well, that's 4 times the work for that one bite of carrot versus a cooked carrot. I can put that in my mouth, gum it a little bit and swallow. And that's so much more energy I can take. So, and for whatever reason, toast somehow digests better than just bread. Sometimes, bread gets really gloppy and that can get hung up in our throat or in our chest somewhere too. Sweet potatoes are easier versus white potatoes, and sometimes just how you cook your eggs. Like fried eggs might be a little bit more tough on the outside versus scrambled eggs or poached eggs.
But she was getting better while they were here.
And again, going back to how much we eat at a time, like that's important too. Are we doing a huge dinner before we go recline for the night? And whenever we eat a lot, it feels great, but it stretches our stomach and that can put more pressure on where the bottom of our esophagus meets our stomach. And so again, maybe that gateway is not really tight because we ate some foods or we drank a little bit of alcohol and just relaxed. Well, now, man, I just ate that second piece of whatever and I really feel it. Well, now we're more likely to have reflux just because it was so much at one time. And so again, thinking about our energy level when it comes to breathing and swallowing, sometimes that means splitting up our meals into more frequent, smaller meals. Maybe a small breakfast and then a snack, lunch and then a snack, or maybe lunch should be our big meal. So we have a little more energy in the middle of our day versus at the end of our day when maybe, it's harder to breathe or we've been coughing a little bit more. One of the biggest things though is not eating and laying down. It's like the number one possible thing that we can do to improve your asthma, to improve your reflux for kids and for adults. I have a 13-year-old at my house and we have, if bedtime is 9 o'clock, kitchen is closed at 6. We have a very strict, no snacks after dinner unless, all right, when are you going to have your dessert? Because this is a hard bedtime. Because if you don't have it by this time, it's just, sorry, we can't do that. That means eating dinner a little bit earlier. So maybe I do want a little bit of a snack afterward. So then trying to stay up for as long as we can. Even if it means sitting on the couch relaxed, it doesn't mean sitting at the table. But, this is also important to have a lot of grace with yourself because you're figuring out what works, what doesn't work. And it's a lot of trial and error, that sometimes I have patients say, well, I've been avoiding my favorite foods for the most part, but I'm still coughing a lot. Okay, well, maybe we should write down, when are we having those coughing episodes? What time are we eating? All of those are big factors, even if we don't think about how what I ate last night is impacting my breathing today. So, and it's okay too oh my gosh, that combination that I ate for lunch yesterday does not agree with me today, turns out. Well, now we know, and then we can use that moving forward that, what, I can have a taco, but just one, and maybe not with a soda at the same time, and knowing what combinations, what triggers really do, hit you the worst. So, part of this has zoomed in too much, but I actually printed several copies of this. So this is one I can pass out. This is just the general reflux precautions. So, these are all the things that I work on with my pulmonary patients, that when we're eating and drinking, we want to be sitting up. We don't want to be in, I understand at the end of the day, it's great to sit in our recliner and be collapsed, but that concaveness impacts how your ribs and your lungs are sitting. So trying to sit up as much as we can, nice and straight. That also, gravity helps pull things down. And then we want to stay up for at least an hour afterward. Again, so gravity can do its job getting everything pulled down. More frequent, smaller meals. Not drinking too much with your meal can be beneficial too, because sometimes we fill up a lot just on the liquid. There are some known irritants. So alcohol relaxes those muscles at the bottom of our esophagus and the top of our stomach. But alcohol is really dose dependent. If we have a little glass of wine once in a while, for most of us, we can tolerate that. But if we're doing like a bottle of wine right before we go to bed, well, that's going to trip me up a lot more versus, well, I just had a few sips after lunch the other day. We can control it. That it doesn't mean, all right, sorry, we're never drinking again. You might be able to. There are certain alcohols that are more acidic or less acidic. So like beer would trigger reflux more because it's got those bubbles. So it's going to bring things up. Red wine is somehow less acidic than white wine. Not sure why, but it's just on the pH factor. But it doesn't mean that you have to give up all your favorite foods. But it is something that we can control. So there are a lot of acidic foods like onions. Garlic is a big trigger for people. Tomatoes, citrus, so oranges, pineapples, lemonade, things like that. Tomatoes is a big one because we use that in so many things. But one of the ways that we can offset that is if we're having a bowl of spaghetti, we can sprinkle a little bit of sugar on our tomato sauce, and it helps decrease the acidity of the tomatoes. So I don't want to have to give up Italian completely. So there are ways that we can, modify things slightly, or maybe I don't get that second serving. Maybe I just have a salad instead and try to be healthier with that. Let's see. But there are the biggest things that trigger reflux. So soft drinks, anything in a bottle or a can, it's going to be really acidic. Alcohol. Fried foods, because that's really irritating in the stomach. So foods that are high in fat, the more inflammatory. For about 2 out of 3 people, chocolate is a trigger. No one's happy to hear that. Caramel, though, is okay. It doesn't typically bother us. That chocolate has some compounds in it that increases acid production in the stomach, and it relaxes those muscles at the bottom of our esophagus and the top of our stomach. So if we like, chocolate bar after we eat or drink, well, now we've created this very acidic environment and relaxed these muscles and kind of invited that up into our throat, which we don't want. Onions, peppers, spicy foods, things like that. There's certain nuts that, like fattier nuts, cashews and macadamia, those ones can be a trigger for some people. Garlic. And only 35% of people with reflux are affected by tomatoes. I hear from everybody, it's almost Hanover tomato season. So, and if we want to have tomatoes, maybe having some fresh tomato on our salad or on our sandwich is a way that we can still enjoy that versus like the canned or the stewed tomatoes with the garlic and the onions and all of those things. But I've known a handful of my patients, they'll say, well, these things don't bother me, but gosh, I had a big coughing episode after strawberries, or, for some people, like bananas should be fine. But for a small percentage of people, bananas are a trigger. So it really is learning what are the things that we can tolerate and still have in our food box. And what can we, what are the things that, all right, I have to minimize that a little bit or make some little changes so that it's not triggering. That's really the big thing about the silent reflux that I wanted to talk about. I do have some information on some breathing techniques because the respiration system and swallowing are so intertwined. I wanted to jump up a little bit. I did it kind of out of order. And so there's a lot of bacteria out there. We're breathing it, we're ingesting it, we're coming into contact with it quite a bit. Part of the job of our respiratory system is to get rid of those pollutants and to help clear that out. So yes, we are getting air in, but it's also filtering that air so that it doesn't trigger an infection. So we breathe about 25,000 times a day. It's a lot. It's a lot of, pollutants in the air that we're coming into contact with. And we know that getting air in, and so at the very end, at the lower part of our respiratory system, we have our alveoli, and that's where that gas exchange takes place, where it transfers the oxygen to the blood, and then takes the takes the carbon dioxide and transfers that out. And so when we have some respiratory problems, it can be harder to get the right amount of oxygen in, or to rid the body of carbon dioxide. So sometimes there's a buildup of that carbon dioxide, and that can trigger more problems too. So one of the big things about the respiratory system is it's got that mucus and that lining. And so that's what also helps, that those upward beats of the cilia that line our trachea, that's what's helping clear that stuff out of there. But there are some different pulmonary problems that trigger more secretions, or sometimes a little bit thicker. And so when we have those thicker secretions in there, that makes it harder to get the air in or out. So if you think about breathing through a straw, that would be a little bit challenging, but we could do it. Okay, what if I gave you one of those coffee stir straws? Well, that would be almost impossible. And so for some people that have COPD or pleural effusion or things like that, that lining is so irritated with mucus that there's less airflow and there's less of that gas exchange. So we're going to be more tired. We're going to eat a little bit less, or maybe what we do eat isn't as nutritionally as valuable. And so there's a lot of things with our diet, with our breathing, that we can really do to help improve that. So we know there's the upper respiratory tract. So that's everything above the larynx, your mouth, your nose, all the way to your vocal cords. And then there's the lower tract. And so that's trachea and the bronchus and all the way down to the alveoli, where that gas exchange takes place. And so one of the really big things is our diaphragm. And so whenever we have COPD or breathing problems, we don't always use our diaphragm the way that we're supposed to, because it's actually a lot harder sometimes to use that muscle to push our stomach out of the way and let our lungs fill up more downward. So because it's easier, or because we're fatigued, or because we're stressed, a lot of times we'll use these accessory muscles, and these are not meant for breathing, they're meant for posture. So when we're using them to get the air in or out, it's less efficient. We're working too hard. We're not getting the same amount of air in and air out and helping facilitate that gas exchange. Okay, so we know there's a lot of things that impact breathing, and some of that can be, even how anxious am I? Because, even in preparation to speak to you guys, I was getting a little bit short of breath and thinking about, okay, well, when I'm stressed, that impacts my breathing. Well, now if I'm short of breath, now I'm going to be more stressed, and they can really negatively impact each other. So we know there's a lot of different things going on with our lungs. And there's a lot of different causes for that. With asthma, there's things that we can inhale. There's things that we can eat. There's things that get injected, or things that we just come in contact to. All of those can trigger a flare-up. And drugs is on all of these, that sometimes we have a negative reaction to medications. And so this is where, we talked about those 5 systems of dysphagia. When there's a problem with swallowing, a lot of times our breathing is impacted, and vice versa. If we have a problem breathing, a lot of times our swallowing is impacted, because just all of that timing and coordination can't quite happen in the same sequence as it's supposed to. We talked about that we got to hold our breath for 1 to 2 seconds, and that's a long period of time when we're sitting down to maybe Thanksgiving dinner and we're trying to visit with the kids at the same time, and we're trying to talk, and hold our breath and swallow. And so what happens is, you know, if there's complications or we've had trauma or anything like that, there's a breakdown in that system. And so as we get older, we know some of those muscles get a little bit weaker too. So then it's hard to get enough air in and squeeze it out the right way. So it's not just diseases that we might have acquired, but it's also age can play a factor in that too. And so when we talk about like the electrolyte or a pH imbalance, some of this pH imbalance can be because of reflux. If we have a pH imbalance in our throat, then that's going to impact our breathing and our swallowing. One thing I do want to touch on is the importance of managing secretions, because for a lot of us that have respiratory problems, we have like thicker secretions, and those, if our lungs are a little bit weaker, it's hard to cough it out. And so that's why the diaphragm is important, because if we do cough, if we have anything go down the wrong way, we want to have it be strong enough to forcefully get that out of there. So we'll do a lot of breathing exercises with our pulmonary patients so that if something does go down the wrong way, well, hopefully your body can react in time to clear it out of there so it doesn't cause an infection. And so, you know, thinking about with COPD, those infections are kind of thick. And then with congestive heart failure, it's kind of frothy and foamy secretions. And so if we're dealing with a lot of that stuff built up in our throat, it's going to be harder to swallow. So we've got all that stuff built up in there. Now, one thing that you can do if you feel like you have a lot of secretions and it's hard to sit down to a meal because I've got all this stuff in my throat, you can actually munch on some ice chips, and that helps thin out those secretions so you can either cough them out or swallow them, and they're not taking up that space in your throat. And hydration is really important here. So making sure that we are drinking enough water so that those secretions don't have. We've all seen some dehydrated secretions when those are really, really hard to cough out, especially again, if our lungs are a little bit weaker. All right, so I'm going to skip a couple of these. And so when it comes to COPD and swallowing or any of these pulmonary things, a lot of times there's a loss of that coordination with breathing and swallowing, closing your airway off to protect it in order to swallow, and then everything going back in place so that when you're done swallowing, I can breathe again. And so when we have swallowing problems, that can lead to aspiration, pneumonia, fatigue, decreased quality of life. Maybe we can't eat our favorite foods anymore. But I'm jumping ahead to, all right. So what can we do, you know, to improve that breathing while we're swallowing? So one of the techniques is pursed lip breathing. And so that's breathe in through your nose, out through your mouth. And it's going to help slow down that breathing. Because remember, when we panic, those are nice, they're too bad, but they're short little breaths versus that's going to improve that ventilation. And we'll want to decrease the air trapping in your lungs, because whenever we have COPD, it's harder to get that air out of there, and some of that CO2 is stuck in there. And so, again, working on that, work smarter, not harder. We want to decrease the amount of effort getting that breath in. It's a lot of work. You know, if we have COPD or fibromyalgia or any of those things, it's exhausting just to breathe or to hold a conversation sometimes. And so it's going to make that shortness of breath not nearly as severe. And when we're more relaxed, we breathe better. So there's pursed lips breathing. There's also diaphragmatic breathing. So that's really using that stomach muscle. So when we breathe in, we want to push your stomach out. And when we breathe out, you squeeze your stomach in. And so when we have any pulmonary comorbidities, a lot of times our shoulders are what move a lot more, and that increases that tension. It's less efficient, so we're getting less air in and we're working too hard. Now, this is hard to do when we're used to breathing a certain way. One of the tricks, though, is to lay on your back, and as long as your breathing is okay. But our body naturally belly breathes while we're resting. because it shifts into this is a better way, a better use of our energy to get this air in and out. And so people that have COPD tend to use these little muscles, so it becomes even more fatiguing when we're really trying to help conserve that energy and conserve that air. So doing some of these diaphragm muscle exercises can be, let's do that for a few minutes at a time, a few times a day, because this is going to be work. And so it takes time and effort to strengthen those muscles. And it might be fatiguing. I've had patients say, well, I can't do it for more than 3 minutes because then it's just a lot of work. Okay, then only do 3 minutes 4 times a day. Just do it here and there. When you're at the stoplight, while you're waiting in line at the grocery store, while you're watching TV and the commercial comes on, we can try to incorporate that. And again, keeping it short and sweet. And so again, thinking about that relaxation, then when we're relaxed, we're going to breathe more easier and better. So positioning is important here too. So sometimes leaning forward a little bit, that expands your lungs. And so one of the techniques would be leaning forward, put your elbows on the table, that supports your rib cage, so you don't have to use your muscles nearly so much, and it expands your rib cage back and forth, so that as you breathe in and you're supported, your lungs can actually have more space to fill up. And leaning forward a little bit tends to relax our chest and shoulders. And so breathing techniques are that breath in and out is easier to get. Again, trying to be relaxed.
Lauren, can you wrap it up in like 60 seconds?
Yes, I can. One other thing is trying to, sometimes when we do feel short of breath, what can we do? Because I need to breathe right now. Do something called paced breathing. And so we pause. We're going to breathe in, swallow, breathe out. So what you're doing is you're refocusing that control on, I'm the person in control. My body's not going to decide when I can breathe and not. But if I can pause, swallow, and then breathe again, rest for a minute, and then you should have that breath back. And so it's just reorganizing and refocusing that all of those structures and muscles so that they can move in an intentional way rather than, well, my body's just doing this and I'm here for the ride. But again, thinking about that when it comes to eating, if we're short of breath and it's hard to catch our breath as we're eating because we're holding our breath so much, maybe we need to pause, breathe in, swallow, breathe out. Okay, I'm going to rest for a second and then proceed again, so that you guys have the control, so that you're feeling more empowered. Good.
Lauren, you have done an unbelievable job. This young lady had 200 slides really of information to graciously share, and she was doing her best to condense what she could in a very short period of time. I could have sat here and listened to you for hours, Lauren.
I know it's a lot of information. I was really trying to see, because reflux is so important and so prevalent, I really wanted to make sure that we didn't run out of time on that part. But also, what are some practical things that when you go home, hey, you know what? I have a way that I can breathe better. If I just sit a little bit differently, or if I just hold my posture a little bit differently, or breathe in my nose, out my mouth. There are ways that we can reduce that stress and tension and anxiety.
That's a really good point. A question I have for you is, if anyone, would it be permissible if someone has got some personal questions related to that, are they permitted to call you?
Yeah, absolutely. I will give you my cell phone number or my email address, and I'm going to pass out these cards. My group has put together a really helpful website that is completely free. You do not have to sign up for anything to access that information. It's really user-friendly. There's different videos, and so some of the information about reflux and swallowing.
Nice.
That's online. There's a video about, well, what happens to my swallow as I age? Because as we get older, things are a little bit different and the muscle moves differently.
Can I ask a yes or no question real quick?
Yeah.
For acid reflux, silent or otherwise, is it, I find that if I sleep on my left, I'm okay. But if I sleep on my right, I'm in.
Yep, absolutely.
So
And
does everybody need to know?
yes, so the other thing too is we can sleep with our head and shoulders up a little bit at night and get that gradient. We get our shoulders above our stomach. then we're less likely to have that reflux come up. But for some people with back problems or anything like that, sleeping elevated is not possible. You can sleep on your left side. So that video at the very beginning, that still picture, we talked about, well, the stomach is on the left and we have a smaller lung on our left. Well, because the stomach is on the left, whatever is in it, the stomach and its contents, when we lay on our left side, stays down. But when we lay this way, the stomach and whatever's in it can push at that connection. And so sometimes it's just a postural change that can improve your breathing for the next day. That was a good question.
And you're the best. Thank you.
I really tried to summarize it. I'm sorry to keep you for some.
Guess what? We appreciate you. Thank you so much. You're welcome to stay for the business side of it. I'm gonna make it really, really, really short.
This is what you do.
Yeah.
Yes.
Yes.
Next month, our picnic, we're having a picnic next month. So be looking for an email from Ronnie. I believe you're sending it out about, you get to pick what you want. I believe we're going to have it from front porch, that's what it is. Front porch, everybody so likes that, and you'll get a chance to pick what you want, and all of that's furnished by Breathmatters. So, looking for that. I will not be here, but guess what? The rest of the team has got it. Any questions? Who's never been to our picnics? Okay, where's the old there? Picnic is at,
Huguenot Park.
okay. Which is, and it will, the directions, so the first thing will be Ronnie's gonna send you an email with your choice. You will respond to her, and maybe in that email or the normal monthly reminder will tell you specifically where it is.
It's shelter 2 on Huguenot Park. You Google it,
Yes.
and when you pull in off, I think, Huguenot Road, Huguenot Park. It's just a straight shot on the right hand side, and there is a shelter and then set of bathrooms right next to it.
Robius Road.
Oh, Robius Road.
Same place. Same place, you've always had it, but I wanna make sure the newbies are comfortable with it, and you can always call Ronnie, call any of us. I won't be here, but what's the day? The same as our monthly meeting, the second Monday of June at 11:30, right? 11:30. That's a
No,
change.
this one's this one.
11:30. And the reason it's 11:30 is because of the time slots allocated for the use of the pavilion. Okay,
They do half day slots, 2 of them,
right.
and I think it's June 13th. If I remember.
Pardon me?
June 10th. Excuse me.
Any other questions related to that? Due to time, I want you to have plenty of time to socialize, have plenty of goodies. There's lots of food here that needs to be eaten. Help yourself. I know we've got a smaller crowd today, but guess what? That gives you more opportunity for food to eat. Just don't overdo it unless this is your big meal of the day.
I know there's another sheet that went around, and this is one of the things I got off of our presentation was you can simulate what it feels like to have some difficulty breathing, or you guys don't need to practice that. But, if you have healthy family members, you can say to them, here's a normal balloon. Look how it swells and deflates, easy, no problem. That's a normal person's lungs. But what about a small balloon that we really have to work to get it inflated, and then it deflates really quickly? Well, patients that have pleural effusion, that's what that's like. It's a struggle to get the air in, and then the air rushes out and some of that air trapping. So there's different types of balloons that simulate different lumps, but also we breathe through like a milkshake straw, which that's no problem. A smaller straw, okay, I can adjust and get the air in. Well, how about a little coffee stir straw? Absolutely not. So when we think about how some of those, the lining of our lungs, if it's a little bit swollen and that air is harder to move, we're working so much harder. So that fatigue and getting enough nutritional value is really key. But there's some different things that you can simulate at home for what it would feel like to have this kind of dysphagia or that kind of breathing difficulty.
All right, guys, enjoy the rest of your day. Enjoy some socializing time, food, and see you at the big day.